Hi, I'm Ross Feldman from the Robarts Research Institute in the University of Western Ontario in London, Canada. What we're talking about today is the effectiveness of a simplified regimen for managing high blood pressure. We devised what we call the STITCH algorithm, simplified treatment intervention to control hypertension, which features the use initially of low-dose diuretic ACE inhibitor or diuretic ARB combinations, followed by use of calcium channel blocker and then third-line drugs. We devised this as a simpler approach to the management of hypertension than more complex guidelines. To study the effectiveness of that approach, we randomized 45 practices and studied more than 2,000 patients. Practices randomized to either guidelines-based care using the national Canadian guidelines or our STITCH algorithm. At the end of 6 months, we followed their blood pressure and analyzed as a primary outcome the proportion of patients in each practice, at blood pressure control targets. What we found was that in those practices assigned to that STITCH algorithm, blood pressure control was much better. That is 12% better. That's a relative, in absolute terms, that's a relative improvement of more than 20% in the proportion of patients in practice in the STITCH care group. This was associated with greater use of fixed-dose combinations and paralleled a greater blood pressure reduction in the STITCH care group. Altogether, we think this simpler back to the future step care algorithm may be very important in managing blood pressure and improving the abysmal control rates we have both in the United States and globally. This simpler approach may also be an important paradigm for devising simple algorithms for the management of a range of chronic disease important in coronary artery disease and stroke.